Hello, and welcome to the Joint Replacement Program at Overlake Medical Center and Clinics. We are here today for preoperative education, which will help prepare you for your joint replacement surgery, help you understand what to expect during your hospital visit, and also to help plan your recovery. We will first begin by discussing how to prepare for your surgery. The first step in planning is recognizing who's part of your care team. Your care team includes your surgeon, physician's assistant, anesthesia team, patient navigator, nursing, primary care department, physical therapy, social worker, and last but not the least, your coach. Communication is a vital part of care planning. Information is shared between team members to optimize your surgery and experience. MyChart is a preferred tool to use to communicate with many members of your care team, and often it's the fastest way to get a hold of them. If you have questions on how to set up MyChart, please call MyChart helpline at 1-844-750-8525. A key portion of getting prepared for surgery is finding someone who is going to be your key source of support, or what we at Overlake like to call your coach, following your surgery. Your coach can be a family member, friend, a neighbor, or any responsible adult who is able to commit to helping you recover. One of the main roles of your coach is to learn about your care to help ensure you have a smooth transition from pre-op preparation to your hospital experience and finally to your recovery at home. Other responsibilities include encouraging exercises, activity, mobility around the house, transportation to and from the hospital, follow-up appointments, as well as general errands and light housekeeping. After surgery, once you're transferred out of recovery, it is expected that your coach is present for education and training with nursing and therapy staff. Most of our patients discharge the same day of surgery. If you do stay overnight for a medical reason or a functional reason, your coach will need to return the following morning at 8 a.m. for therapy training and continued nursing discharge education. Patients are typically discharged between 9 a.m. and 11 a.m. Let's talk about durable medical equipment or DMEs. Everyone, including both hip and knee replacement patients, will need a front wheel walker with 2 stoppers on the back prior to surgery. Keep this walker in your car while you're at the hospital. We can teach you or your coach how to fit or adjust your walker according to your height. We can use the ones we have here in the hospital. Walkers with 4 wheels are not appropriate. They're generally not safe to use after a joint replacement surgery. So please make sure you have a front wheel walker. Also, you can consider getting a single point cane if you have stairs in your home, or you can use the cane to use it as a transitional device after your walker whenever your therapist recommend. If you're having a hip replacement done, you may want to avoid certain movements and motions after your surgery. You may want to look into purchasing a hip kit. Hip kit contains long lever tools to help you do things like put on your shoes and socks without bending forward. These items can make it easier for you to perform daily tasks after surgery independently. You can find these items for purchase on online retailers like Amazon. Shower chair, tub bench, and grab bars can be also very helpful to reduce your risk of falls in the bathroom. Raised toilet surfaces can be very nice to ease the transition of going from sit to stand, and maybe even nice to have if you have certain hip restrictions that require you to sit on surfaces that are more elevated. You should speak to your physical therapist prior to surgery to determine if any of these items can be helpful or appropriate for you to use. Thankfully, there are many places in the community where you can easily obtain these items we just discussed about. There are places like Bridge Ministries, local senior centers, churches, garage sales, any medical supply store, and online retailers. When it comes to fall prevention, we want you to look at your current home setup with a fresh pair of eyes. Set up a recovery center in your home. Keep commonly used items in a designated spot, which is within your reach. Having a easy access to phone, medications, tissues, wastebasket, water can be very helpful. Clearing clutter, removing tripping and slipping hazards to help aid moving around when you're using a walker in your house is very helpful. Try to remove throw rugs and secure all the electrical cords to the edge of your room, and clear more space between furniture. Stairs are typically not a big barrier to home discharge, but if you have multiple stairs in your house, consider setting up a place to sleep on the first or entry level floor. You can use a comfortable couch, recliner, or cot to sleep in. Getting a good chair, which is firm or higher than average, the chair that has higher than average seat can be very helpful to raise the seat height. Low chairs with soft padding can be difficult to stand from, and they can increase the risk of dislocating your hip if you're having a hip replacement done. You should stock up on a lot of pillows to help you elevate your surgical leg, and pillows can help you sleep comfortably too. Next up, we're going to discuss about nutritional tips before and after surgery to consider. Staying hydrated with water and electrolyte-rich drinks is very helpful. We would want you to avoid excessive caffeine as it can lead to dehydration. Staying well hydrated leading up to your surgery day can reduce risk of post-operative nausea, help with low blood pressures, and it can even help with grogginess and lightheadedness too. A healthy diet provides nutritional building blocks to optimizing healing and recovery after surgery. Protein-rich diet helps with the wound healing process, and it can also reduce your risk of infection too. Healthy sources of protein include lean meats, fish, yogurt, eggs, beans, nuts, seeds. Protein shakes protein shakes is a good and quick, easy option that can really help you after your surgery, especially if you're experiencing nausea or loss of appetite afterwards. Fresh fruits and vegetables are a full source of vitamins and minerals, and that helps with overall energy and recovery. They can also help you with the constipation too. Fiber-rich food like beans, lentils, broccoli, squash, green peas can also help minimize constipation. Especially if you have issues with constipation before surgery, it is important you start eating fiber-rich food before coming in for surgery to maintain regular bowels. It, the, if you have any specific questions, please consult your primary care physician or dietitian. These are some of the suggestions that can help you improve your nutritional intake before your surgery. Next up is important part of pre-op planning, pre-admission. Pre-admission happens a few days before surgery. You will get a pre-admission phone call from Overlake 1 to 3 days prior to your surgery. A nurse will review your medical history. They will also go over medications to make sure you're prepared. You will also get a call from our admissions team the day before surgery, where they will provide you two key times, the surgery time and the arrival time. Your arrival time is always going to be 2 hours prior to the surgery time. So it is very important to make sure you arrive on the time. Let's talk about paperwork and what you need to bring with you on the day of surgery. We do recommend you bring a list of your medications, including the name, dosage, and when you take it. Also, write down any supplements you take, as well as any allergies you may have. We do need to confirm everything you're taking to ensure there aren't any potential reactions with anesthesia. Advanced directives. is another thing to bring. If you already have a living will, a post form, or a document stating your medical wishes, please bring a copy of this so we can include it in your medical file. If you don't have one, we can provide you with a guide to advanced care planning booklet. You can easily download this booklet from our website too. This packet has durable power of attorney for healthcare form, has healthcare directive form, and on these forms, you can easily express your medical wishes as well as name someone who can make medical decisions for you. Handicap permit parking. Since you're having your joint replacement, you're eligible to obtain a handicapped parking permit for your surgery. You have to get this from your surgeon's office prior to your surgery day. You will take this form to your local vehicle licensing office closest to you to obtain your placard. This placard is valid for first 3 months after your surgery. We do want you to be active, walking, and moving as much as possible following your surgery, but it is nice to have something available for your appointments and follow-ups. Now let's talk about packing and what you should bring to the hospital for your surgery. Remember, many orthopedic surgeries, including joint replacements, discharge same day from the hospital, but it's good to be prepared in case we need to observe you overnight or for a medical or a functional reason. We do ask everybody to bring 1 to 2 pair of clothing. We prefer it to be comfortable, loose-fitting clothes like gym shorts, t-shirts. We also prefer loose-fitting clothes so your nursing team can easily check your surgical site when needed. Please do make sure you have shoes that are closed heel and toe, like a sneaker or a tennis shoe. Flip-flops are not allowed. Personal toiletries are also not necessary, but you're welcome to bring them. We would request to please leave all valuable items at home, such as jewelry, watches, money. Please do bring your dentures, hearing aids, glasses. If you use a CPAP at night, bring that as well. If you use eye drops, ear drops, inhalers, we would request you to bring those with you and let your nurse in pre-op know that you have these. Your surgeon will need to write an order for these after surgery while you're in the hospital if you would prefer to use those in the hospital. During your pre-admission phone call, the nurse will tell you to leave all the routine medications and prescriptions at home. We will supply you with the same medications from our pharmacy. The nurse will also let you know to bring any uncommon medications that our pharmacy may not have in the stock. Please leave your bag in the car until after your surgery is complete. We do not want to risk losing any of the items between transition from pre-op, surgery, and recovery. After your surgery, your coach can bring all your belongings to the room. You can also leave your front wheel walker in the car as well. Key aspects of hygiene and infection prevention for you to focus on leading up to your surgery. First, we ask you to stop shaving 3 days prior to surgery. This not only includes your surgical site, but also anywhere on your body. A small nick on your leg or underarm or face can be an open entryway for bacteria to get into your system. It is also important to think about oral care prior to surgery. Good oral care, including brushing your teeth and using an oral antiseptic solution, helps minimize bacteria in your mouth and also getting into your bloodstream. We want your body focused on healing your new hip or knee and not fighting off any other bacteria. Focus is infection prevention. Hand hygiene is critical to infection prevention too. Make sure you wash your hands frequently with soap and water, and make sure you use your hand sanitizers often. You will also need to shower the night before surgery and the morning of surgery, and you're going to wash yourself with the Hibiclens solution after showers. You will be given a bottle of Hibiclens or CHG solution at your pre-op appointment. The Hibiclens is an antibacterial concentrated soap. If you were not provided with this at the office, these solutions are readily available over the counter at any pharmacy. For step-to-step instructions on showering, please refer to our pre-surgical showering instructions videos. Most important guideline to remember is when to stop eating and when to stop drinking before your surgery. You are to stop eating all solid food and liquids you cannot see through by midnight, the night before surgery. No gum, no hard candy, no lozenges, no milk, no dairy products, no coffee creamer. If you had a full stomach under anesthesia, your surgeon may cancel your procedure for fear of you choking on contents in your stomach. Staying hydrated is very important. Please continue to drink clear, non carbonated liquids until 2 hours before your arrival to the hospital. Clear liquids include water, apple juice. These are some of important aspects of preoperative care to help you prepare for your surgery to ensure you have safe and successful recovery. The next video will cover information related to experience at the hospital. Thank you for your participation, and we look forward to seeing you soon in the hospital.